to systems of care. This will be a very brief overview of the concept of cultural humility. And so this is just an introduction, but I wanted to sort of lay out the concepts for everyone. And again, appreciate the opportunity. Just wanted to mention that I have no conflicts to disclose in terms of disclosures, and then just give you some key objectives to lead the presentation today. So we'll talk a little bit about equity because that's very well tied into cultural competence. We'll talk about the continuum of cultural competence and then specifically get into cultural humility. And then I wanted to also end the didactic on giving you all some tools or some strategies as you move your work forward. So when we talk about cultural competence, I always think it's a good idea to sort of start off with why it's important. And when we think about why it's important, I want to be mindful of sort of the disparities that exist in the behavioral health world. So when we look at access to mental health treatment for children, there are disparities among racial ethnic groups. So from the data sort of available to you right there on the screen, 31% of white children with mental health problems receive mental health services. That's not a great percentage as is, but when we compare that to children of diverse racial and ethnic backgrounds, we see it's even smaller, so around 13%. And so there are questions regarding, are there issues with access? Are there issues with the type of treatment or the quality of treatment that maybe precludes individuals of diverse racial and ethnic backgrounds from maintaining or staying in services? And so these are all questions that we want to sort of answer or sort of think about in terms of quality of care and cultural competence being a large portion of that. This just sort of outlines that as well. It sort of looks at access, questions of access, but then also questions of comfort. So over the top of the figure, it says, during the past 12 months, was there a time when you needed mental health care or counseling services but did not get it at the time? And you'll see the percentages relatively stable across the groups there. But then if they did not receive services, or if they did receive services, did they not see a mental health care professional because you did not feel comfortable talking with a healthcare professional about your problems? And you'll see that the numbers or the percentages of individuals who did not feel comfortable are quite high, but they are also disparate if you look at the numbers across our diverse racial and ethnic groups. And so what this would suggest, or what this sort of lays the groundwork for, are questions regarding why would, or what factors maybe play a role in that level of comfort. And certainly cultural appropriateness of services and cultural responsiveness of those services would be potentially one factor that contributes to the percentages you see here. And so when we think about quality of services, or we think about the cultural appropriateness of services, it does tie into issues of equality and equity in terms of services. So I just like this figure. I think it sort of plays out the differences between the concepts very well. Equality is really focused on sameness, sort of same allocation of resources across individuals or across groups. So it really does emphasize that similarity or that sameness. Whereas equity is more about understanding where someone is starting from and then allocating resources to help them reach their sort of best outcomes. And certainly that can look different across individuals or across groups based on where their starting point is and based on the factors that contribute to their current starting point. So I just like this graph because I think it demonstrates the differences between those concepts very well. And so we're talking about behavioral health equity or behavioral health equity issues in behavioral health. We really are talking about basically everyone having the same opportunity to be as healthy as possible. And when you think about it in the behavioral health space, it's to be as behaviorally healthy as possible, regardless of background, regardless of any demographic or socio-demographic factors. Behavioral health disparities are those things that exist when we don't have equity or we don't have equality in terms of services. And those are the systemic differences that generally exist across groups. So higher rates of certain mental health concerns or higher rates or lower rates of access to mental health care for certain populations. Those would be examples that contribute to those behavioral health disparities. One of the ways that we're attempting to address behavioral health disparities or sort of those inequities in services are through the national standards for culturally and linguistically appropriate services. The class standards are, this is sort of a nice schematic of the class standards overall. We generally have a principal standard and then they're sort of broken down into subdomains, but really sort of operate as guidelines for how to think about the cultural appropriateness of services in any sort of healthcare setting or healthcare space. I know this is a little hard to read, but these are the actual standards sort of just written out. Again, these serve as guidelines, so you can apply them or sort of think about them in your current setting or in current context in a way that you think would fit your setting. So they're not sort of blanket mandates, if you will, but certainly operate as guidelines for folks to be thinking about incorporating these into your structures and into your services. When we think about the class standards, I like to also think about it from the cultural competence continuum, because just similar to that picture of the equality and equity and the boxes, not every organization, not every individual sort of starts at the same place when it comes to their foundational knowledge or awareness of cultural competence. So cultural competence is thought to exist on a continuum. Here we have sort of another depiction of that. At the very top, we have sort of the side of the cultural competence continuum that assumes very little work in this space, so and work that potentially could even be harmful in some ways. So we start from one side of the continuum from cultural destructiveness, so that would be to intentionally deny, reject, or outlaw any other culture or sort of deny cultural differences, all the way to the very end, which is sort of what we're aspiring to or working towards, which is cultural proficiency. So being proactive in promoting cultural diversity, seeking opportunities to improve cultural relationships. If you look at that continuum, you'll see, obviously, there's some spaces in between, and it would be, I think, helpful for folks to sort of take a step back and think, maybe where are we on this continuum? Because that'll help outline, what direction or what steps need to be taken maybe to get to that next step. And so this just sort of gives you an overview framework of that continuum. Cultural proficiency, again, as I mentioned, is sort of the aspirational thing that we're aiming to. It's the knowledge, skills, attitudes, and beliefs that enable people to work well, respond effectively to, and be supportive of people in cross-cultural settings. I really sort of just liken it to the ability to effectively work cross-culturally. That's sort of what it boils down to. So what is involved in being culturally proficient? A big component of that is cultural humility. And we'll talk a little bit, spend the rest of sort of the didactic really focusing on what this is. So cultural humility is a lifelong process of self-reflection and self-critique to understand personal biases and to develop and maintain mutually respectful partnerships based on mutual trust. It really focuses on more of an interpersonal stance, and it really focuses on your own self-reflection. Sort of what are you as a provider or you as an agency bringing to the table when you're interacting with another individual who may be of a diverse cultural background compared to you. I like this quote, honestly. I think it really captures the essence of cultural humility if you boil it down. What is the sort of the take home of today's presentation? It would be to be culturally humble means that I'm willing to learn. That's really what it distills down to when you think about cultural humility in this context. It really is sort of you as an individual taking a step back, doing some self-reflection and understanding that you're not necessarily going to be the expert on any other culture besides your own. And so as a function of that, always sort of being in that mindset of being willing to learn about another individual and about another individual's background and all the experiences that sort of lead up to that individual being who presents in front of you. So why do we focus on cultural humility? Well, a lot of it is because what we see culturally, what is visible to us at the naked eye, is only about 10% of that iceberg. And a lot of what we don't see about an individual, a lot of what makes up their cultural background and how they identify is beneath the surface. And so there's really no way to sort of get at knowing someone or sort of really working very closely with them in terms of understanding who they are, all of the components of their identities, all of the components of their cultural backgrounds, without really thinking about all of the stuff that we don't necessarily see. And so we're always in that process of trying to learn about those things. And so that's sort of the parts that we aren't visible to the eye, but that require us to sort of be in that mindset of, again, being willing to learn and being open to learn. Why is that important? Well, because we all actually have various aspects of our own culture. So this is an activity that I actually do with a lot of my adolescent patients. I just sort of have them fill this multicultural self circle out. They put their name in the middle, and then in every little circle that sort of extends from the main circle, I ask them what are the sort of the most important parts of their cultural background that they'd like me to know. And they sort of put those aspects in those circles. And I think it's a good way to sort of understand what is important or what sort of makes up their cultural background, but then also I think it basically sort of displays the fact that none of us would fill this circle out, even if we're members of the same family, we wouldn't likely fill this out similarly. And so we really do carry lots of different aspects of culture with us individually as well. So just to distinguish cultural competency versus cultural humility, a lot of the language is around cultural competency, and that's sort of the broad umbrella or framework. Cultural humility is sort of means to achieving higher levels of cultural competence. But the most distinguishing part is that cultural competency tends to imply that one can function with a thorough knowledge of the value and beliefs about another culture, whereas more humility sort of denotes that more self-reflective piece, looking at yourself and sort of what you bring to the table and how then that sort of interacts with other individuals who may be of a diverse cultural background from yourself. So just again, to sort of distinguish between them, cultural competency tends to focus more on group traits. Historically was focused on differences across racial, ethnic lines. Cultural competency tends to more imply a static process or a defined course or curriculum. You know, we take this course, it checks the box for cultural competency, and it seems to imply focusing on achieving competence or expertise, like there is an end result. At some point, you could be culturally competent. And we're sort of shying away from that and really focusing more on cultural humility and acknowledging that this is more of a lifelong process, that we're never going to be an expert or sort of the expert on any particular culture other than your own. And so this will never be an ability to achieve competence, if you will, but rather we can continually get better at being more culturally humble and continuing to learn and do things that help us be aware of biases and things that we bring to the table sort of on an ongoing basis. We're really focused on achieving humility and flexibility here. These are the attributes that really sort of are associated with cultural humility: and openness to learn, willingness to learn, aspects of self-awareness or self-reflection, egolessness, so assuming we're not the expert, so taking that piece away, supportive interaction, so really working as a team or collaborative relationship with individuals you're working with, and then that, again, that self-reflection and critique piece. And why is it important? Well, because as individuals, we bring biases with us. We all have biases. It doesn't make us a bad person. It just makes us human. It's just a human condition. And so some of our biases we may not even always be aware of, but they may come out in different behaviors or statements or in different interactions. And so it's important for us to constantly sort of be in that willingness to learn, humble mindset in order to really sort of understand how those biases may play out. So as I mentioned, bias is a universal human condition that must be recognized and managed. It is not a personal defect, and I think that's the most important lesson. Implicit bias, just sort of this is an explanation of that. And then I just wanted to have some time to mention what can you do. So we just sort of talked very briefly about what cultural humility is, why it's important, but what do you do with this? So where do we go from here? I've outlined some steps here in terms of thinking about ways that you can start to think about yourself as a provider, yourself as a caregiver, or yourself as a member of an agency, and things that you can do to start making more headway or doing more work in this space. I really like this tool, the Implicit Bias tool from Harvard. If you click on the link, it'll take you to the Implicit Bias website, and you can actually take tests in terms of sort of understanding maybe where your personal preferences are, or where maybe you have some blind spots or some biases. I think it's a really great tool, and it's definitely at least a conversation starter and maybe an eye-opener in some respects. I've taken several of those tests, and for myself, I think I'm pretty good at sort of knowing about cultural competence, but certainly even with that test, there were some areas where I was a little bit surprised for myself. So I think that's a good tool. Another tool is a sort of a self-assessment of where your agency or where you are in terms of cultural competence. So that'll help tell you sort of where you're at right now and maybe give you an idea of where to go from here sort of moving forward. So again, if you click on that link, it'll take you to a self-assessment or organizational assessment tool. And then just some other, recommendations to consider cultural and linguistic competence in the context of health equity. So again, how are we addressing behavioral health equity? Developing partnerships with the community, groups who advocate for vulnerable populations. The systems of care echo itself functions just like that. You call on community partners, you call on key stakeholders within the state of Ohio. So this is actually a really good example of sort of that kind of recommendation or step. And And then for your own agencies or for your own areas, consider plans for cultural competence. If there's not a strategic plan in place for class standards, or there's not a strategic plan in place regarding cultural competence, that may be one place to start, is starting to develop a plan like that, so that you can identify gaps in areas for improvement and have aims or objectives that you can continuously do some monitoring or improvement in. And I just provided some resources there for you guys. The implicit bias test is there. The website to the self-assessment is there as well. And then some really good work from the Kerwin Institute right here in Ohio, and then another website as well. And I think that pretty much cuts my time, so I think I just made it.